Welcome to the Appletree Medical Group. My name is Dr. Tyson, and it's my pleasure to guide you through a virtual tour of one of our facilities today. Before we walk through the reception area, it's important to point out that the point of entry to healthcare is no longer someone walking directly into a medical center. The point of entry for us is really somebody using their computer at home or at work or even at their cottage. People are hurried nowadays, and we respect their time. To that end, we have tools such as our wait time tool on our website, which allows patients to see which doctors are on duty and to see the approximate waits updated every 15 minutes. We also have a very advanced portal tool which allows patients to not only see the wait times, but also to book different types of appointments and also to manage their appointments through rebooking, cancellations, or even requesting new ones. Additionally, they're able to view things from home that in the old days they would have to phone or come in for, such as seeing whether their test results have arrived and whether or not the doctor had called them. Lastly, a lot of patient anxiety and concerns are eliminated when you have a more transparent organization that allows patients to see, for example, at home, the reasons for phone calls if they missed the call. Our group's a very progressive one, and when patients do arrive for their appointment or without appointment, their next step is to go to the kiosk and to register using a self-registration kiosk that we develop. When a patient does come into the office and comes into an Appletree reception area, they're guided over to the nearest kiosk. Appletree introduced the first touchscreen multilingual kiosk screens into healthcare in the mid-90s, and we're recognized experts at providing kiosk technology to improve privacy, to overcome language barriers, and also to ensure the safety of our staff during potential pandemic periods like H1N1 or SARS. Patients can come to the kiosk, register in their own language, and it guides them through the reception process while checking insurance validity, as well as allowing them to safely update certain elements of their ongoing medical history, check their allergy history, and also provide a little bit of pre-triage screening history that then is transferred directly onto the tablet of the staff member, the medical assistant who is going to bring the patient into the room and prepare them for their visit. After the patient registers, the system will tell them to please make themselves comfortable, while the staff will receive notification that they're ready to be brought in to see the doctor. If a patient comes in with an appointment, or if a patient is without appointment, is immaterial in our system, and in no way is it flagged to other people in the reception area, meaning that people who are come in for appointment-based practices are brought in based on their appointments, and people who come in without appointment are queued and seen in a first-come, first-served basis. While waiting in the reception area, the patients can watch the Medical News Network, which is a narrowcast medical network which allows for informative programming, education, entertainment, and has the effect of reducing the sense of time spent waiting, while also allowing the Appletree doctors a venue to educate the patients around topics that are of importance within their practice and about programs that the doctors would like to make more available to patients. From the portal, the wait timer, to the kiosk, from the kiosk to the medical assistant, and then on to the doctor, the Appletree EMR system is a very advanced system that is designed around mobility and teamwork.
Ms. Smith, please come on in.
The Appletree medical assistants are trained to bring the patient into the room and to perform triage to improve patient preparation and documentation of the visit and objective findings. They're trained at Appletree U on over 41 clinical scenarios that save the doctor on average 6 minutes per case and improve the quality of care as well as the quality of documentation.
Thank you, Ms. Smith. The doctor will be with you shortly.
The medical assistants, once they've completed triage, mark on our system that the patient is now ready for doctor. Simultaneously, the chart gets moved to the doctor's tablet and is flagged as ready to see the doctor. and also keeps track of the wait time so the doctor, when they come to see the patient, can at a glance see what they are in for, that they're ready to be seen, and how long they've been waiting. Dr. Johnson is finishing with her last patient. Because the EMRAdvantage platform is designed for mobility, our doctors can either dictate, template, or write their notes and do their documentation and orders without loss of time. Now she's opening up the next patient's visit, reviewing what the medical assistant has done and documented, and seeing the main reason for visit before going in to see the next patient, all without any hang time.
Hi Lori, I'm Dr. Johnston. How can I help you today?
While the doctor is with the patient, taking their history and doing their examination, any prescriptions, requisitions, or discharge instructions that they order are automatically printed for the patient and then provided to them by the staff before discharge from the office that day. Additionally, if the patient has tests ordered, for example, when they are at home or at their office, they can check their patient portal to see when the results have come back to the chart and whether the doctor has called them back or not. Likewise, they can use the portal to then book follow-up appointments as necessary, or to see whether messages have been left for them by the office. Our goal is to have a completely connected, comprehensive system so that the patient is always in touch with their records, their care, and the administration of the office.